10 years ago, HIV/AIDS was a death sentence in Africa. When President Bush was in office, he launched a federally funded program to save lives called PEPFAR, a program still in effect under President Obama. Today, contributing correspondent Jenna Hager is here to tell us about her recent trip to Africa, which sounds amazing.
Yeah, it was terrific. Good morning. My parents have continued working in Africa, traveling this time to visit programs with proven track records and to announce a new initiative to fight cervical cancer, a life-threatening risk linked to AIDS. They invited my sister and me to join them, a family trip that became so much more. A new day is dawning in Africa. A tangible sense of hope is on the horizon. A decade ago, AIDS threatened to wipe out an entire generation of Africans. But today, grassroots efforts are changing the destiny of Africa's people. Our trip begins here in Tanzania. It's a place hit hard by HIV/AIDS and cervical cancer. So my family brought us here to check out some of the places that are making a big difference. Our first stop, Dar es Salaam, to one of those projects funded by the U.S. program PEPFAR. Jipende means love yourself, and it's an organization transforming hair salons across Tanzania, turning hairdressers into healthcare educators.
The focus has been mainly on HIV/AIDS, but the program also covers other health areas, including family planning, as well as breast and cervical cancer.
And how long has this program been in existence?
We started the program back in February 2010. To date, we've been able to enroll a total of 70 salons.
Asmina, a client at Jipende, says visits here have become so much more. They're life-saving lessons. How important is it for you to make sure you learn how to protect yourself and to keep yourself healthy?
This is more important to everybody, not to me, most of the women, because healthier is the thing which makes you live. You have to be healthier. And about HIV, you have to be more protective.
Across town at the Ocean Road Cancer Institute, women who are living with HIV are now sick with cervical cancer. On this trip, an announcement of a new initiative using public and private funds to fight cervical cancer and save lives. We're here on World AIDS Day. What is it like to be back in Africa after?
Well, it's uplifting. We've seen firsthand the lives saved. I am grateful to the American people's generosity, and I'm hopeful that that generosity continues.
This is a cancer hospital we're in, and many of them have cervical cancer, which is entirely treatable and preventable. We're going to do through the Bush Institute now to add to the PEPFAR platform in partnership with the State Department, cervical cancer testing, treatment, and vaccine.
And you think it's especially... We leave Tanzania, inspired by stories of hope and survival. Our next stop, another African country making great strides against AIDS. Here comes Zambia Day 2. Ready to land. We arrive in the capital city of Lusaka. Hi! Nice to meet you. How are you? Wongo! To a warm welcome from a fiercely proud people who hold traditions close. From there, we travel to the George Urban Health Center, a clinic which targets HIV transmission and cervical cancer. People are living longer lives. We meet Naipile. Her name means gift. And she says her gift on this day, her newborn baby girl. How long ago was she born?
2 hours ago.
2 hours ago?
Yeah.
How long have you known you have HIV?
I knew my status in 2009. To protect this one, I took all the prevention they gave me.
Healthcare workers here say that 10 years ago, every baby in this ward would have been born HIV positive. Today, it's just 1 in 20. And they promise to fight for a better future and an AIDS-free generation. And so on this day, they sing a song of hope and celebration as we witness the gift they hold most precious, life. Tomorrow on Today, we'll introduce you to some inspiring young women who say that they are the future leaders of Zambia. It was an amazing trip.
It looks incredible. And just looking at the maternity care, that woman's baby had been born 2 hours prior, and the amount of time she has in the hospital is what?
8 hours. 8 hours. We actually saw her leaving, walking through her village, holding her baby. Which is, you know, when you think about the healthcare we have here, it's unbelievable.
Sort of shows you the challenges you're up against. And then the Tanzania part, if you were going to get the word out about something, you would tell the hair salons, right?
Listen, we know here, we talk with our hairdressers about everything. We get advice, we talk to them. So these hairdressers tell these women how they can keep themselves healthy, their babies healthy, and their families healthy.
Most incredible thing you saw when you were there?
That woman was incredible. She said, we walked into the clinic and she said, I have HIV and I want to share my story. She said, my name means gift. This is my gift. This baby will most likely, 99.9%, not have HIV.
It's a great piece, and we can't wait for tomorrow.